So, welcome to this video, which is part of the Reiki online training module. And this is the video part of the module that deals with actually how to give Reiki. Now, when you're signed up for my course, this part of this module has got a large written component to it, which explains in greater detail about setting up the room and things for Reiki. And this room is not set up as I would like it to be set up for Reiki, but it's the only place I can do the forming, so don't judge this. But what I want to do is show you the important things physically when you're giving Reiki, in terms of how to position your hand on the person that you're giving Reiki to. So first of all, the best way to give Reiki is to have somebody on a couch, on a treatment couch like this, which is just about the right height, which means that you can actually put your hands on them and you're not bending over and hurting your back. It's quite possible to give Reiki to somebody on a bed or on a sofa. Not quite as convenient, because you probably do end up having to bend over, and that can put some strain on your back unless you have a stool or a low chair to sit on. Right. The important thing about giving Reiki to someone is that you need to be able to reach the whole body easily, all the way from the head all the way down to the feet. Some people in some of the text that you will see, they do indicate that there are hand positions for literally directly treating the back, and it assumes that you will at some point ask the person to turn over. I don't do that. I can't really see the point. So generally, once you've got the patient or the client lying on the couch, just want them to get comfortable and just leave you to do what needs to be done. So Reiki can be given either hands off or hands on. So hands on means that literally you have your hand touching the person's body, obviously through their clothing or through the blanket. Hands off means that you have your hand very slightly off their body. This is sometimes called working within the aura. And that can be very appropriate if, for instance, you are working in a sensitive area like the genital area, or in a woman if you're working in the area of the breasts, when obviously touching may not be appropriate. You want to use a very light touch, because obviously you don't want to physically cause any discomfort to the person you're giving Reiki to. And some people may actually be quite sensitive to being touched, depending on what is actually wrong with them and the reason that they've come to you for Reiki. Certainly, if you've got someone who's come with pain in a particular area, you may very well need to be cautious about the amount of pressure that you use. So why don't we always go hands off? Well, it's very simple. Some people do work completely hands off, and I used to when I first started giving Reiki. I stopped because I found physically I got tired, because if you're constantly holding your hands out like that, you are supporting your hands, and that literally does get very tiring if you're doing a full 45-minute or 60-minute session of Reiki. It's important that you remember your physical health and well-being when you're giving the Reiki treatment. So you will have had in the literature that I sent you details of certain hand positions, and you already know that whether you use hand positions or not is largely up to you. But whatever you do, it is quite important that you do work through the whole body. Normally, it's standard to start up at the head, and unfortunately the camera doesn't quite show this, but you can place your hands gently on the top of the head or on the side of the head to start the treatment. Hand on the forehead is another common one. But generally you will be running your hands or placing your hands either close together on the body, or you can have your hands apart. So with that, I have got both hands on the knee, which is fine, or I could have one hand on the knee, one hand on the ankle. It doesn't matter. If you're working intuitively, then you will position your hands where your intuition is guiding you. It's important to make sure that you cover the whole of the body, even if the problem seems to be localized in one particular area, say it's pain in a shoulder or pain in the knee, because that's just how Reiki works. You really do need to, under normal circumstances, try to give Reiki to the whole of the body. So you start at the head. You can then treat the shoulders. You can have hands on the abdomen, either together or apart. As I say, you can have hands on both legs or both hands on one leg, whatever works for you. The important thing is that you give Reiki, usually for about 5 minutes in each position, or 3 to 5 minutes in each position, depending on the feedback that you're getting, either intuitively or from the person that you're treating. In an ideal world, you would be able to walk all the way around the couch. I've already said this isn't particularly ideal, but it's not at all uncommon to find that you're working with the couch actually up against a wall. So it's actually very common to find that you're having to slightly lean across like this to get Reiki into areas on the opposite side of the body to the one where you're standing. Again, that's another reason why you need to be cautious about how high the couch is, because again, you don't want to be leaning over and hurting your back. So it really isn't that complicated. By the time that you actually get to the stage of giving Reiki to someone yourself, you will have an idea of what a good idea of what Reiki is and how you should be trying to use it. That's a lot of what this module and these modules have been about teaching you. The important thing to remember is that you really can't hurt anybody doing this, which is really wonderful. One reason why I love giving Reiki. But it is important to make sure that you understand what it is necessary for you to do physically. Intuitively, you may know that you want to be giving, Reiki into, either a certain physical part of the body or, to a certain area, to a chakra area. But you need to bear in mind that the body has its own sensibilities, and say you want to give Reiki into the throat chakra, well, you don't want to be literally putting your hand on someone's throat. It's going to choke them. So that's another time when working hands off can be more useful than working hands on. So hands on is a very, very light touch. Your hands can be together in one position, or they can be quite far apart. You can have your hands on one side of the body, or have your hands on different sides of the body at the same time. The reiki will still go where it's needed. The important thing is that you are positioning your hands where you feel is right in a way that works for the patient. Although there are rules, it's up to you to get the rules that actually work best for you. So, the two main things that I want you to take away from this video, and this is something that can be discussed in the feedback when we discuss this module later on, is the difference between hands-on and hands-off. Also, there is a certain natural rhythm to how Reiki gets given, at least there normally is. It is very common to start at the top and gradually work down the body to the feet. But sometimes it's a good idea, once you've done that, to work your way back up. So you've worked your way back up to the head again. But a lot will depend on what you get guided to do. Now, when you have physically given Reiki in all the positions that you want to use, and you are getting ready to bring the session to an end, there is something that I was taught to do by my Reiki master, which I will briefly demonstrate to you now. Well, there's a couple of things I want to demonstrate to you. The first is, one way to end the Reiki session is to do what my Reiki master called wrapping the patient in a blanket of Reiki, which literally means, and you do all this hand off, you start at the feet and you just slowly walk back up the body, hands off all the time, and in a way what you're doing is trying to sense any areas that may need treatment, and just bring the Reiki back up to their head. Now, when somebody has had a Reiki treatment, they can feel, you hope that they will feel quite relaxed at the end of the treatment. Sometimes that can mean that their energy can get a little bit depleted, and what this does is help to raise their energy levels up. So that ensures that when you tell them the session's over and they start to come out of the, come back to a more normal awareness, that they aren't, in a very deep state of relaxation. It just brings them out gradually. The other thing I want to demonstrate is something that you can do to help yourself, which is a technique that enables you to get rid of anything that you may have inadvertently picked up from the person that you're treating. And that's what's called the dry bathing technique, where literally it's almost as if you're in the shower. You run your hand down one arm, you run your hand down the other arm. You can even run your hand down your legs and anywhere that you feel may have picked anything up, just to make sure that your energy has been cleansed. If you feel that you're picking anything up on your hands that's still there, it's quite simple. Just literally go out of the door or can't go to the window, and if you just shake any energy that you have off. This has been a very, very brief look at physically giving Reiki. I've looked at giving it on a couch, which is the normal way. It is quite possible to give Reiki to someone seated in a chair, but that's probably something that is best demonstrated during the final module when we're actually face to face. So I hope that has been helpful to you, and no doubt that there will be some discussion about this during the feedback session. So thank you very much.